Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to talk about what is shame. Let's get started. Now, shame is one of those things in the world where people confuse the most with guilt. So, what I've decided to do is in this video, as we talk about shame, I'm not going to talk about guilt, and then I'm going to make another video talking about guilt, and then eventually I'm going to make a video talking about shame versus guilt. So, what is shame? As children grow up, their parents teach them, their caretakers teach them what's right in the world and what's wrong in the world. As these children grow up, their teachers teach them what's right in the world and what's wrong in this world. As they grow up, their neighbors, television, media, friends, so on and so forth, teach them what is right and what is wrong. What's the right thing to do? What's the wrong thing to do? What's a taboo thing to do? What's a non-taboo thing to do? How's a taboo way to be and what's a non-taboo way to be? What's a correct way to feel and what's a non-correct way to feel? So on and so forth, the story goes on. Now, the way that we learn this and what we do with this information is what turns into shame or not. So what we say in psychology is that the process of a parent teaching a child that they've done the wrong thing is the shaming process. All right? Now, a shaming process can be an extremely toxic one, or the shaming process can be an all right one. And by that, I don't mean that the child won't feel shamed, but they just won't feel permanently harmed. Now, let me give you an example. A child goes, grabs a glass, and throws it on the floor, and it breaks. Now here you have broken glass all over the floor. Let's take two different scenarios of two different types of parents here, and I'm just going to say fathers in this case. One father says to their child, "Oh dear, look at that. When you threw the glass on the floor, it broke. And now anyone who walks on it might get hurt. So that's why we don't throw glass on the floor. So make sure you don't throw glass on the floor again, okay? You can play with this cup instead. Here's a plastic cup for you to play with. Come here. Are you okay? Are you scared? Was that a little bit frightening for you?" "Yeah, it was a little bit frightening." "Yeah, child, they won't talk like that. They might say, "Yeah, scared." "Yeah, you got a little bit scared because it made a really big bang." But that's why you can play with the plastic cup instead. It won't make a big bang and it won't break and no one might step on it. Do you understand? "Yeah, I understand." "All right, off you go then." That was the shaming process. You taught the child that what they've done is wrong, what the consequences it might have, and you gave them an alternative for an alternative behavior, what they can do instead. Next time, they can go and grab the plastic cup and play with that. Of course, as they get older, they get more dexterity and so on and so forth, the more frontal lobe functioning, they can start playing with glass and so on and so forth. But that child is not shamed. Now, here's an example from one of my patients. They vividly remember when they were a child, they dropped a glass, it broke, and their father then proceeded to wrap them 15 times with a belt. No words, no nothing, they just grabbed them, took them into the room, took their pants off, and wrapped them and wrapped them and wrapped them over and over and over again. So this person then learned from a subsequent or a lifetime of this kind of behavior that when they do something wrong, they have done something catastrophically wrong. Dropping a glass as a 2-year-old means that you are catastrophically wrong. This, what the father was doing, is something part of the shaming process. So he was shaming through punishment, shaming through physical pain, shaming through physical hurt. And that's a particularly gruesome example, but believe me, when you're a psychologist, examples get much more gruesome than that. So, here's another example. This is a fictional one, not a patient-related one. Child drops the glass, it breaks on the floor. Dad comes up and says, "Oh, you're just a failure, aren't you? You just can't do anything right. You just can't play with anything right. Why don't you just grab the plastic cup? I've told you already to grab the plastic cup. Don't play with the glass. You keep just making mistakes all the time. I'm so damn tired of these mistakes that you keep making." Now that might feel good in that moment to just be able to let yourself go. But of course, what happens there is that that parent is not necessarily aware of what's happening, that they are excessively shaming their child and hurting their child in the process. That child now carries that idea in their mind throughout their life. The all three of these children, of these examples that I give you, bring this with them throughout the rest of their life. So the first child that drops the class and dad sort of kindly speaks to them and tells them about the plastic class, goes to uni at some point, perhaps, let's just say they go to university and they make mistakes. And when they do make mistakes, they say, oh dear, that didn't really work. Okay, I mean, there must be a better solution than that, because obviously that's not really helpful. So I'll find another way to do that. It wasn't the right thing that I did. I need to find another way to do that. It doesn't feel good, but it doesn't feel excessively bad either. The second child example that I gave you, if they even were to make it to uni, by the time they make it to uni, they make a mistake, and before you know it, they're off hurting themselves somehow. They're off cutting themselves, they're off beating themselves up about something, they're off using massive amount of drugs or doing some really risky behavior because they need to get punished, they need to get hurt. Now their dad doesn't have to do it for them anymore, their shame does it for them. Their shame in their minds does it for them. So their parents' voice, the parents' behavior does it for them. And in this case, for this person, there was nothing said, so all they need to do is to go and hurt themselves really quick. In that third example, this kid at uni now might do something really bad, might make a really big mistake, or might fail an exam or something, and what they would be thinking in their heads is, you just can't get anything right, you just can't do anything, can you? You're just useless. Every time you try to do something, why do you even try to do it? You should just do something else, you're just useless. So what is shame then? Shame is that process of what we do with ourselves when we make a mistake. So this is a really key thing to understand. Shame is the process of what you do to you when you make a mistake. Shame has nothing to do with other people by the time you're an adult. If you think that you hurt your partner and you're feeling guilty and you're not talking to them about that, it's not guilt, it's shame. If you make a mistake, you do something, you hurt somebody, and you feel really bad about it, and you're just like bogged up in you and ideas about you and what that says about you and what that means about you and how you have done the wrong thing, and your partner's just off in a corner, you don't even remember that it was them you hurt anymore, you're just talking about how terrible you are in your mind, that's shame. That's not guilt. So shame is a one-person process. It's something that you do with you, by you, for you, not with anybody else. It's not a nice process. It's not a very good feeling process, but that's what it is. We all have shame, and how we shame, what we shame, it depends on our childhoods. So, and of course, with childhoods, I don't just mean that example with a parent. Remember, it could also be teachers, society, and so on and so forth. So that's shame. Shame, in short, is a one-person process, what you do to you, by you, with yourself, when you do what you believe to be the wrong thing. And how you do that, the shaming process, comes completely down to what you've experienced in life. I hope this was a helpful video. I hope if you're a psychologist out there, you can use this with your patients, because of course this is ISTDP theory here that I'm presenting, and you can use this with your patients. They come up to you next time and they go, I'm feeling guilty, and you can go, let's just pause it a little second there and make sure that this is actually not shame. And if you're just a person watching this for yourself, then you'd be able to go, all right, well, yeah, I get it. So what I have going on here is not guilt, it's actually shame. Now, if you're curious about what is guilt, watch my next video on guilt. I'll see you there.